Hello and welcome to My Dietitian Journey. I'm Felicia, owner and registered dietitian at Peraza Nutrition and My Dietitian Journey. This video, I will cover my approach to charting for an initial session. So I'll go over my template for charting, some insurance considerations, and also the flow that I use for the patient's chart. One of the most important things with charting is to make sure that your charts are organized and then also that you're storing them securely. There are a lot of templates that you can use when you're charting, and if you have access to an EMR, a lot of them have templates that you can adapt to your needs as a dietitian. When I first started my practice, I utilized patient charts in a locked filing cabinet, and then I switched to an encrypted flash drive, which was password protected. And now I use Simple Practice as my EMR. As a registered dietitian, I provide medical nutrition therapy, or MNT, which is a nutrition-based treatment provided by a registered dietitian. MNT is an evidence-based approach to treating certain chronic conditions through the use of an individually tailored nutrition plan. It's intensive, it's personalized, and it relies on consistent follow-ups to monitor goals and then also behavior change. So when I chart, I follow the nutrition care process and I chart in an expanded ADIME format, so all of my notes are consistent. In private practice, you do have flexibility in how you chart in terms of the format. However, you want to make sure that your chart has some key components for insurance billing. First, you want to make sure that you have the time of the session, so the start, the end time, and then also the total time spent with the patient. I have this reflected in my chart note, and then it's also in my EMR calendar. You also want to make sure that you have your CPT codes and ICD-10 codes. So again, in my EMR calendar, I can specify the CPT code when scheduling the appointment type. The ICD-10 code is in my patient's chart and then also in my individual chart note. You always want to make sure that you're signing your charts. So if you're using paper charts, this would include you actually handwriting your signature and then dating that. If you're using an EMR, you could digitally sign your charts and it'll have the date and then also your IP address. And as always, you want to check your insurance contracts for any kind of additional information and medical policies that relate to how you're charting for your appointments. This is my charting template for my initial sessions. Over the years, I have adapted this based on what my intake note looks like and how my sessions usually go. The first section is the patient history, so the reason for the visit and wellness goals. In my intake form, I have a question related to this. I typically copy that into the patient chart. I start all of my sessions in a similar way, and I ask what brought the individual to me as a dietitian or what they're hoping to get from the session. I usually end up expanding on this section in the first part of the appointment. The referral source I also indicate, as this helps me to track my patient referrals. Usually this is a doctor or an insurance company. This is also indicated on my intake form as well. For all of my new patients, I conduct a full nutrition assessment with pre-session paperwork and in-session questions. This assessment will help me to identify what nutrition-related problems are present. First, I look at current and past medical history, medications, and supplements. So this information I pull from the intake note. However, I always clarify this during the appointment. In some cases, patients do not indicate medical conditions on their intake form, especially if it's managed. Some do not consider it to be an active problem. I also want to point out before I move any further that I try not to be super clinical and really intense when I run my sessions. I don't go line by line with my chart note. Sometimes this is the order I'm charting in, and sometimes it's not. I created my template like this so it was easy to navigate through and then find information during and after the session. For current medications and supplements, I usually just confirm which they are taking and how often, especially for supplements. For the recent and upcoming doctor's appointments, I include information about their primary, specialist, and mental health providers. For biochemical, this includes home testing, like glucose testing, blood pressure, and also labs. For biometrics, I do gather weight information in the intake form along with their height. I calculate BMI for the sole reason that I use it for insurance billing. There are many flaws with BMI, and I do not typically talk about what the patient's BMI is during their session. I only indicate a desirable body weight if the patient is talking about weight loss as a goal. Under weight history and changes, I indicate the highest and lowest weight and then also the weight trend for the individual. During the first appointment, I have a conversation about weight. Is this a metric to track? how often. I try to avoid being weight-centric with sessions, but I do want to have a conversation so the patient and I are on the same page and I know how to proceed moving forward. Usually at this point in the conversation, we talk about how often to weigh in. Some patients are doing this way too often, non-scale victories, realistic goals, and then also concerns they have. For current and past physical activity routine, I do indicate if they were engaged in or not for activity. And this is also, again, taken from their intake form. I get clarity on their exercise routine if they do have one. I usually also explore barriers and goals when we have this conversation about physical activity. Lastly, for this section, that's the food nutrition history. From their intake form, I input allergies, intolerances, and alcohol use. I do also run a 24-hour recall in the session, though it's not as formal as the one, and probably you have learned, in school. So it's a little bit more informal of a process, and I go through what their typical day looks like, and then their beverages, and then also how this might change on the weekends. After the assessment, I would make a nutrition diagnosis, which is step 2 in the nutrition care process and involves a PES statement. If you need a refresher, PES stands for problem, etiology or cause, and signs and symptoms. PES statements provide the identification of a nutrition problem that is specific, and it gives you direction for the type of intervention needed and the outcomes to monitor and document. I do use them in my practice. It is important to note that the diagnosis step is under the scope of a dietitian. However, this is different from a medical diagnosis, which is done by a licensed physician. A nutrition problem I often utilize is food nutrition related knowledge deficit. Usually I add this in after the session is over or during if there's a clear one indicated from our time. Next is the nutrition intervention part of the session, which includes specifics about the care plan and how to implement it. During this step, I provide nutrition counseling, maybe education, and provide nutrition recommendations as needed. Some common language I use in the intervention section is food and or nutrient delivery, so general/healthful diet, specific foods/beverages or groups, nutrition education, so nutrition relationship to health and disease, recommended modifications, and then nutrition counseling, so motivational interviewing, problem solving, self-monitoring, and goal setting. I don't often cover nutrient needs in the first session since it's usually a lot, but if I shared any information about fiber recommendations, for example, I would indicate it here. I also include information about handouts or resources I am providing, and if in session or via email after. So an example is emailed food tracker during appointment, sending handout on fiber after session. The dietitian notes from the call is usually a brief section. So I usually say something like new patient appointment, reviewed in detail medical history, food nutrition history, exercise history, and lifestyle, provided nutrition education, set goals based on priorities, discussed insurance coverage, all questions answered. Next is the nutrition monitoring and evaluation, which should align with your intervention. Together with the patient, we would set specific goals and action items to complete between the appointments. Some beginning goals I have set with patients include Goal 1, areas and level of knowledge. And then under patient actions for Goal 1, review emailed information on fiber. And then for Goal 2, I might have self-monitoring at agreed upon rate. And then the patient actions being track for 7 days using the chart provided and upload to the portal. The next part of my note is the follow-up information. So the date and time for the next session and insurance information. For an initial session, I would indicate something like 5 sessions for 2024 remaining so I can stay on track and stay within the coverage. Under the provider recommendation, I include the frequency for the sessions, so whether they're weekly, bi-weekly, monthly, or bi-monthly. The next part of my chart note is the billing information. I indicate the CPT, ICD-10 codes, POS or place of service code, modifier, units, the charge, and then the start and end time as well as the total time. This aligns with what is billed. I also update the calendar to reflect the time as well. The next section is coordination of care. So if I need to coordinate with the primary or maybe a therapist, finally I type in my provider information and then I digitally sign the chart once it's finished. I do chart during my sessions now. I initially did not when I first started. I would just take these shorthand notes and then I would transcribe them after the session. After working in a contract job in an outpatient clinical setting, I needed to chart at the same time. And so now I chart during all of my sessions. I find that it saves a bunch of time and I don't miss things that the patient has said. So usually the chart is filled out completely by the time that I'm done with the appointment. but I might spend maybe 5 minutes or less at the very end of the session or right after I finish the appointment to just kind of clean up the note before I end up signing it. I hope it's been helpful to learn about how I prepare and chart during a session. Thanks so much for listening, and reach out if you have any questions.